Growing up in Northeast Ohio, Crystal Clinic was a household name. My mother, my father, many of my aunts and uncles had been treated at the Crystal Clinic. When I broke my hand, I was a patient. I left the Akron-Canton area to train, and when it was time to move back, I knew that there was no place here I would rather practice. Procedures I'll typically be providing will be reconstructive procedures aimed at restoring the body, the breast, the face, and the extremities, focusing on not just the form or appearance of those, but also the function. My first experience with medicine was in 5th grade. I was assigned a project on the circulatory system, and I was captivated by that function. As I learned more and more about how the body worked, that interest continued to grow. When I had the opportunity to witness plastic surgery, I saw an intersection of art, humanity, and surgery that captivated me. In my free time, I like to create. I like to paint and sculpt. Recently, I've taken an interest in 3D printing and computer modeling. The coolest thing that I've 3D printed was a prosthetic hand for one of my patients. He was born with only one hand, and during the pandemic, got a devastating infection in the opposite side. I was able to download plans from a British hand surgery group to make a prosthetic hand on my 3D printer at home, size and fit him to that. And for the remainder of the time until the prosthetic clinics reopened, he was able to functionally care for himself at home. And it really was rewarding in that I was able to use something that I consider to be a hobby to cross that boundary back to help someone professionally. I consider myself blessed to be a reconstructive surgeon. I have an opportunity that's rare in medicine, where listening to the patient, becoming a part of their life and their journey, and providing them with an intangible benefit that is improving their life rather than just eradicating their disease, allows me to really treat the patient like they're a member of my own family. Proudest moment for me is that last office visit when the patient is able to walk out after a long reconstructive journey, and I can appreciate how much of a difference I was able to make in their life. My office is oftentimes an office full of hugs, and getting to share in that success with the patient is really what drives me and provides a strong sense of satisfaction.